Hi, I'm Dr. Robert. This is Asu. Asu got an extracapsular repair of an ACL tear. The ACL is supposed to be preventing the shin bone from sliding forward in relation to the femur here. And what our extracapsular repair does is it attaches the femur to the shin bone and basically replaces that mechanism and keeps it from being able to pull forward. Anytime we get a injury where the dog is not going to be using the leg appropriately, we want to make sure that they don't have contracture of their soft tissues. So if you sit with your arm just sitting like this forever, you're not going to be able to extend your arm. So what we want to do while they're in this recovery period, when they're not using the leg, is we want to do passive range of motion. And that means what we're going to do is we're going to put all the joints on the limb through full range of motion. We're going to extend all the joints, hold it that way for a few seconds, and then flex all the joints. And it should be comfortable, so if she pulls away, you just kind of do it nice and slowly, and you just do it to her comfort level. Oh, she's too comfortable. Good job. And so you do all the joints working up. What this does is it helps with maintaining that range of motion whenever they're healing, and it also getting joints to move is the best thing for joints. A joint sitting still is going to get inflammation. It's going to try to heal in a rigid stance rather than being nice and flexible and mobile like it's supposed to be. So this is our actual operated joint. So we're going to extend and we're going to watch her. We're going to make sure that she's nice and comfortable. If she's starting to pull, we're not going to push it any farther. We're going to just hold it at the extent that she's comfortable. We're going to wait a few seconds, and then we're going to flex it. You can combine this with icing the incision, the operated area. It helps with the inflammation and the amount of comfort they'll have during this. I'm flexing it pretty well. She's doing real great. And then the extending and then moving also helps to stimulate the swelling to go down. So if you move the joint and move the soft tissues, it stimulates lymphatic drainage, and all the swelling that you'll see down here by the ankle will resolve a lot faster. That can also go away whenever we get 3 days out after surgery. We do warm compresses to help to get that to drain away. So we're doing our knee, flex it all the way up. She's really comfortable in flexing this knee, which is really great for after an ACL tear. This is a great baby. All right, and then we're gonna do the hip too. Flex it. And remember, whenever you go up, you're going to affect the joints that are lower. So while her hip may not be painful, she might give us resistance as this knee straightens. And that's okay. It's not our worry spot. She's going to, but we do want to make sure that she can at least get it to functioning angle. So this is good enough. She seems to be uncomfortable because I'm pushing on her quadriceps that pull on that knee. So we're just going to hold it here, flex it up. She's going to get better as time goes on too. So it's not just we're going to remember this spot. We're just going to watch her, and however much she'll let us do it each time is how much we're going to do it. So this we do for the first 2 weeks while we're doing absolutely no activity. We're sitting in a kennel doing nothing, and then we're going out to go to the bathroom, and that's it. So we want to just make sure that as this is putting scar tissue around, that scar tissue stays nice and flexible. And then when she's using it normally, we don't have to do it anymore because she's going to do it. It's no longer passive at that point. It's called active range of motion. So when we're doing active range of motion, we can tell them sit, and they'll flex all their joints. Stand up, they'll extend all their joints, get them to even stand up on their back legs once they're building muscle. Walking up hills, going up steps extends their hips more, builds that muscle back as we're doing physical therapy. But that's after the healing process. So while we're doing nothing, this passive range of motion is really important starting point.